Okay, looks like we have a number of people here now. Welcome everybody to the Monkposium webinar series. We have with us today our special guest, Jessica J. from Ostoform. She's going to speak to us about adhesive breakdown and ostomy rings and seals. I just want to introduce Jessica a little bit. As an ostomate and IBD advocate, Jessica has embarked on a mission to empower individuals facing similar health challenges while leveraging her expertise as a sales and education consultant with Ostoform since 2021. Since becoming an ostomate in 2011, Jessica has made it her mission to help bridge the gap between medical innovation and patient care. She is dedicated to raising awareness, sharing her experiences, and providing support to those navigating similar paths. Jessica is going to give her presentation in just a moment. I just want to note, you can see over to your right, there's a chat area. I'm going to be monitoring the chat. So anytime if a question occurs to you, you can put it in the chat over on the side, and at the end of the presentation, I'll be moderating a little Q&A with Jessica. So I'll just be, sort of collecting questions over there. So without further ado, take it away, Jessica.
Thank you so much for having me here. Let me start this presentation. All right, there we are. Thank you, Adam and Medical Monk, so much for hosting this webinar and being such fantastic partners. I'm really excited to be here. Like Adam said, I am an education and sales consultant at Ostoform, but I am also an ostomate. So with that said, let's dive into our discussion on adhesive breakdown in ostomy rings and seals. So I'd like to start with some statistics. The first statistic is that 93% of ostomates worry about leakage. As an ostomate myself, I would bet all of us at some point in time are worrying about leakage, even if you have a great system in place and rarely experience leaks. There is always some point where your stoma will behave like a bad 2-year-old. The second statistic is 75% of ostomates will experience peristomal skin complications. So that's 3 out of 4 people living with an ostomy that are experiencing skin breakdown. This is a staggering number. With all the different appliances and accessories that are available to us, we're still having these issues. The third statistic is skin complications account for 33% of the visits to stoma nurses. So a third of the visit to an ostomy nurse are for skin complications. These skin complications are also incredibly expensive. That adds $80,000 to the per patient cost of care in the first 120 days after ostomy surgery. So these statistics illustrate that there is a clinical need in the market where needs have not been met. Our goal at Ostoform is to resolve these needs so ostomates can worry about the important things of life. We should be worrying about the things that bring us joy, not worrying about leakage and skin breakdown. So the reason we are here is to talk about the adhesive breakdown in ostomy rings and seals. And you might be saying, what do we mean by adhesive breakdown? Hydrocolloid is designed to absorb, which is really not the best when it's corrosive output. It soaks this up like a sponge, and then it breaks down incredibly fast, which leaves corrosive output sitting on your skin. And this obviously leads to moisture-associated skin damage. And then when leakage and skin breakdown starts, it's a vicious cycle that is so hard to break. So as we learned from the statistics, 75% of ostomates experience skin breakdown. There are a wide variety of reasons for these complications, including the incorrect size or fit of ostomy products. And sometimes there's environmental factors like humidity. That's really just out of our control, and that's unavoidable. However, hydrocolloid adhesive breakdown is one of the root causes of leakage and skin complications for ostomates. Hydrocolloid breakdown also results in a reduced appliance wear time, leading to a reoccurring cycle of leakage and worsening skin conditions due to mechanical dermatitis. So mechanical dermatitis is usually what's happening when you're taking those adhesives on and off your skin all the time. This results in skin breakdown, not only that is expensive, but leads to discomfort and psychological impact. And then Adam is going to put up a poll that's asking you all, have you experienced skin complications when using a seal or a barrier ring? And then while you're answering that, I'll keep talking here about our leakage problems. So we know with the statistic that at least 93% of ostomates are worrying about leakage. But what I find even more devastating as an ostomate is that 1 in 3 ostomates are limiting their physical and social activities because of leakage worries. It's so debilitating. With some 12% of ostomates resorting to social isolation. That's heartbreaking. Leakage obviously also leads to greater appliance usage and greater use of stoma supporting products. We also know that ileostomy patients are significantly more likely to worry about leakage because of the watery output that we have. And then we have another poll question that is asking, have you experienced leakage when using a seal or barrier ring? So I'd like to tell you a bit about Ostoform. Through the participation in a Stanford-affiliated medical device incubator program called BioInnovate, a team of engineers and designers, including our CEO and co-founder, Kevin Kelleher, who's a PhD in biomedical engineering, they were tasked with finding solutions to unmet clinical needs. They noticed the high prevalence of peristomal skin complications. And the eureka moment occurred when it was determined that a contributing cause of skin problems was the absorbency and resulting adhesive breakdown, which we talked about, of ostomy appliances. This led to the design of a totally new and innovative product concept, the Ostoform seal with flow assist. And while developing this prototype was exciting, seeing its positive impact on the quality of life is what really inspired Kevin to bring those products to market. The flow assist is, you can see there in that picture, that's that spout. It's a soft and flexible non-absorbent polymer. And in that picture, you can see that the flow assist is integrated from about 3 o'clock to 9 o'clock on the seal. This is helping to shield the skin and seal, preventing that adhesive from breaking down, and therefore can help provide extended pouch wear time, leading to significant cost savings over time. That flow assist spout additionally is channeling your output away from the skin and guiding that output into the pouch, and directing the output into the pouch, which is obviously helping prevent leakage. So you might be wondering, who's a good candidate for the Ostoform seal? It's especially useful for the people that are experiencing leakage or are suffering from peristomal skin complications. It is intended for a high fluidic stoma or high output stoma. So ileostomies, urostomies, but obviously there's all sorts of reasons why a colostomy patient might have a bit more watery output. And then that flow assist spout is super useful for people with flush, shallow, or retracted stomas to help that output be guided into the pouch. And then for anybody that's requiring an extended wear time. So I think these photos from actual ostomates who are using the Ostoform seal speak for themselves. However, the feedback we receive is just as impactful as these photos. One ostomate says that the Ostoform seal is the best seal they've used. Another ostomate talks about how Ostoform has changed their life. And then another says that they're no longer struggling with leakage and are now able to go out dancing. And I really think we can't put a price on a good quality of life. I am going to show you a video with the steps to use the seal. It's an innovative product, so there are a few unique steps. I personally find that it's easier to see it rather than me talk you through it. So I'm going to play this video from Maggie at the YouTube channel Let's Talk IBD. Hopefully we can get this started here.
Okay, let's dive into the fitting steps. Step number 1, ensure the wafer is cut an additional 5 millimeters or 1/4 inch to ensure that there's enough room to accommodate the flow assist. The key thing to remember here is that the hydrocolloid or the adhesive should not be exposed once you have the wafer in place. As we all know, everyone's stoma shape and size is different, so if the 5 millimeters or the extra 1/4 inch is a little bit too much for you, you can adjust this. Remember, you can always cut more off of your flange, but you can't put it back. I always try to take a nice conservative approach when it comes to cutting my flange to fit the flow assist, and I really try to focus my extra room towards the bottom where the flow assist sits. Before I remove any of the backing from the Ostoform seal or the backing from my flange, I'll test it out a few times, try it out, see if the flow assist fits in there without showing any of the adhesive on the seal, and if it doesn't quite fit, I'll go back, cut a little bit extra, and try it out again. Once I get to the point where it fits together nicely, none of that adhesive on the seal is showing, and I know that my stoma will fit through the opening in the flange, I'm all set to go. Okay, let's jump into step number 2. Wash your hands and make sure that the skin around your stoma is completely clean and dry before fitting the Ostoform seal. Remove the seal from its packaging, but before removing the paper liners, warm it up in your hands for about 30 seconds. Step number 3, position the flow assist so that it's below the stoma or rotate it to align with the opening of your stoma. I find the easiest way to accomplish this is actually by holding the flow assist. This gives me the best control over where I'm placing the seal. Step number 4, as you apply the seal, make sure that the tabs overlap. Again, this allows for the closest fit to your stoma. Step number 5, ensure that the flow assist spout is fully inside of the pouch or through the base plate opening. Before fully pressing it down, you'll want to pull the flange up to fill that slot underneath of the spout. If you use convexity, I would recommend lightly pressing down on the spout once your base plate is on. Sometimes convexity can cause the spout to tip upwards. Step number 6, apply light pressure around the stoma and the pouch to ensure you've achieved secure adhesion. You can do this by putting 1 or 2 fingertips right around the stoma and gently pressing down. If your pouch has a viewing window or is clear, or you haven't placed your bag onto the flange yet, take a look just to make sure that none of the seal adhesive is showing. If any of it's exposed and you haven't fully pressed down your flange, this is the time to try and adjust it a little bit to cover that adhesive. Hopefully this video gave you a good idea of how the Ostoform seal with Flow Assist works and how to fit it properly to your stoma. It has been a real skin saver for me when my output gets inconsistent, and I've had a lot of trouble with that, with my output getting watery and seeping under my flange. The Ostoform has prevented that and has increased my wear time.
All right, that's a great video, I think, showing you how to use the seal. And I'm going to pull my slides back up. Give me just 1 second. We do have some exciting news. At Ostoform, we're launching a 2-piece system in continuing on our innovation in ostomy care. And in 2024, we will have this 2-piece system that has the Flow Assist spout integrated into the base plate. And if you're interested in trying this out, you can register your interest on our website, ostoform.com. And just to leave you with, we are at Ostoform dedicated to delivering the new standard in ostomy care. We hope to earn the right to travel through life with every ostomate. And thank you all so much for joining us today. And once again, Medical Monks, thank you so much for having me.
Thank you so much, Jessica, for that presentation. We really appreciate it. We do have, I see that we have a few questions going over here. And also, well, before we get into the questions, actually, I do want to point out that Medical Monks is offering free samples of Ostoform seals. I am actually going to pop this up on your screen right now. You should see this pop up, a link to a form to request free samples from Medical Monks. So if you go over there, fill out your information, Medical Monks will send you out a couple of free samples of Ostoform so you can try them yourselves. So let's get into the Q&A. No, I'm not sure. Let's see if Jessica might have some insight into this. Linda asks, I lived in Southern California at the ocean, so slightly humid. I moved 2 weeks ago to Northeast Tucson, which is very dry. Do I have to worry more about dry, hot weather for adhesive sticking issues?
I personally, and I'm not by any means an expert on, the weather and environmental changes in the ostomy appliances, but I would feel like heat and humidity would be more of a problem just with sweating and things like that, having that moist environment versus a hot or dry environment. I think you're probably would be better off in that drier environment.
So I also have Marlene made, well, it's more of a comment, but I think that Jessica might have something to say about this. Marlene says, I have tried the Ostoform seal many times and have had a great deal of difficulty attaching it to the pouch.
Yeah, it's an innovative product and there are unique steps, and we are aware that there's a bit of a learning curve with using the seal. The exciting thing is we do have a version 3 that will be coming out towards the end of this year, where those unique steps will no longer be the way to apply it. So you'll use it just like you would any other mold fill ring, no extra cutting of the wafer or anything like that. And I think that's probably the trickiest part. I will say if you're comfortable with where the two ends of the seal overlap around your stoma, and if it's easier for you to put it on the back of the wafer rather than straight on your skin, that's fine. It's more just we want you to know how it's going to fit for your particular stoma.
Okay. Beth asks, any recommendations for how to apply when the stoma is retracted and is below skin level?
Yeah, so this is obviously who the seal really is targeted towards. And we know there's no stoma sticking out or budded stoma. Just put it around, like essentially where the hole is, where that stoma is retracted at, but we don't want to see like a lot of exposed skin.
There's a question that I think I know the answer to, but Karen asks, if you're having difficulty, should you consult with a certified ostomy nurse?
Obviously, yes, absolutely. No, if you're having difficulties, I will always point you in the direction of an ostomy nurse, whether that's in person or some of the virtual ostomy nurse services. They're so valuable, and they have so many tips and tricks that just the everyday person doesn't have because they have such learned experience.
All right, does anybody else have any more questions? I think we've gone through what we have here. Shawnette asked a question actually that I can answer. How do I choose the proper size when requesting a sample? My stoma is approximately 45 to 50 millimeters wide and up to 1 inch tall. So when you go to when you click through to the form, it will actually give you options for which size. You can sort of base it on the size of your stoma, which one you should request. So you just see it on the form there, and you can just choose yourself.
Yeah. And just on that, there are 3 sizes. So we have small, medium, and large, and there's that size guide there. If you're between the 2 sizes, between like small and medium to large, size up to the larger size so that you have enough space to overlap the ends. On that particular question, her stoma size was slightly outside of our largest size, which our large will fit up to 40 millimeters. It's okay if you're having a lot of issues and you've kind of gone through all sorts of things and still not really finding a solution. It's fine to try the size large, but what I want you to do is take a piece of hydrocolloid from like another multiple ring, and you want to bridge the gap between the two ends of our seal. So we don't want you to have any exposed skin at the top, if that makes sense.
Okay. Let's see, we got a few more here now. Joan asks, I have a one-piece appliance. Will this work for it?
Absolutely, yeah. It's compatible with any appliance, one piece, two piece, flat, convex, doesn't matter. You can use it with any appliance, any brand.
Okay. I see Brian asks, I have a hernia that protrudes outside my stomach around the stoma. I can't find any convex wafers that help. Do you know of any? I'm willing to bet I know what you're going to answer, but
we'll plug another product here. So this is something that I think a lot of ostomates struggle with. I personally have struggled with multiple parostomal hernias. Maybe not the most compliant with wearing the support belts and those things to help prevent those. But if you're struggling with a lot of leakage because you can't get a good seal all the way around for that hernia, I have found that I really like the Coloplast Convex Flip. I think it does a nice job of conforming to that body contour where you had that like bulging area. Was that what you thought I was going to say, Adam?
Yeah, exactly. I have Kay asking, how does it hold up when having to use powder to absorb, I'm assuming, excess moisture?
That's fine. Yeah, you can do any of your normal skin prep. That won't affect it at all. If you do like a crusting technique or whatever skin prep you do use, that's fine to use it. Most importantly, I would just make sure you hold it in your hands for like 30 seconds to make sure it's good and tacky before you apply it.
All right. Do we...
I think I saw someone ask if the flange, if the flange sticks out. I think they mean the spout. The spout does stick out. It's really flexible though, and it's not visible under your clothing. And I can I'll hold one up here if you can see. We'll take that paper liner off. So that's the spout there. It's really flexible. I don't have to do much to make that lie down. So once I put this on, and if I have, like underwear or pants on over the top of this, it just pushes that down really nicely.
I'm seeing, Rhonda here. I see, we are seeing your questions. And I'm not sure, Jessica, if you have any insight into this diversion colitis. I'm personally not familiar. Do you see what she's asking, Rhonda?
I see that she says about she has a stoma prolapse. I think I'm curious of what the actual question is. She said, I should have a reversal surgery or I have an ileostomy for 1.5 years. I've been advised I should have a reversal surgery or develop diversion colitis. My stoma prolapse. I know this is off topic, but can anyone just respond? I don't know, maybe if you're like looking for just support on how to handle that. I think certainly if you've been advised by, a medical professional, I would heed their advice. I know, especially with stoma prolapses, it's, they kind of, once they start, tends to happen a bit more frequently.
Yeah, also, Rhonda, I would maybe seek out the United Ostomy Associations of America. They have, a lot of resources and support groups all over the country. So there's probably one near you, but really also their website has a lot of good information. You may be able to sort of access more folks with ostomies and might have some insight into your particular situation. I see Deirdre asks, will these be covered by insurance?
Yes, Yeah, great question. The billing code is A4385. That's called a HCPCS code. And that's the same billing code for any extended wear barrier ring. So like an Econ Seal or Hollister Adapt Seal, all of those had that same billing code. It is covered by insurance.
Alrighty.
I think someone had asked, can you use with convexity? And I think I answered that already, but yes, you can use it with convexity. Kay said seepage from wounds. Seepage is hard to answer that fully. I think you're going to have a hard time getting anything to stick when you're dealing with a lot of like weepage and seepage of your skin. Again, just to plug another Coloplast product, there's those protective sheets that are designed for people who have a lot of skin maceration. I would use that straight on your skin first. That kind of helps absorb some of that moisture, but also then give your appliance a good surface to stick to. So then the order I would do is use that protective sheet, then use the Ostoform seal on top of that protective sheet, and then apply your appliance.
Okay, I see Janelle asks, can I squeeze the adhesive part to make it thinner to fit my convex wafer?
Squeeze? So you mean like the depth of the seal itself? It's a pretty thin seal, so I'm not sure, like if you can just see from here, I would consider this like a slim versus like one of the thicker ones. But yeah, I mean, it's a typical hydrocolloid. You can do what you want with that. Within reason, you can flatten it out if you need to make it a bit flatter.
Here, let's see another question from Deirdre. I have to use
Brian said, okay. Okay.
I am seeing Deirdre ask another question. I have to use stoma adhesive paste in my scar on both sides of my stoma. Would I still need to use this?
That's entirely up to you. I have people that ask me, about using paste or other like those hydrocolloid strips to do kind of like what I would call caulking in those, deeper recessed areas to help get you a flatter surface. And if that's what you're talking about, that's fine to do. Obviously, we've not tested using those type of things with this seal, but I think, again, this kind of goes back to MacGyvering things together to find what works for you in your particular situation. And Rhonda wants to know if I have an ileostomy or a colostomy. I have an ileostomy. I have Crohn's disease. And I've had mine for 12 years. Not invasive at all, Rhonda. Thanks for asking.
Okay, well we're getting a little past the half-hour mark here, so I think we have to call it a day. Or we'll say if anybody has one last question, go ahead. We'll take one more question.
Oh, it's like a drum roll. Who's it gonna be?
Yeah, who's gonna be?
Or what? Or who's it gonna be? What's the question gonna be?
While we're waiting, I just want to reiterate. Over to your right, you can request samples of Ostoform. If you have any questions about the products or any other products from Medical Monks, you can go to medicalmonks.com/gethelp. You can also email customer care@medicalmonks.com. You can connect with us on Facebook, on Instagram, on YouTube, all of those places.
Sean Addis said, thanks for sharing an ostomate perspective. It's important to do. And once these are available to view afterwards, my email address is on that first slide. If anybody needs to reach out with any questions, feel free to.
Yes, absolutely. Yep. Thank you all. Everybody's saying thank you. We thank you for coming. Thank you so much for attending. Being part of our community here at the Monk Posium. It's gone to, this is the most people we've ever had. So round of applause for all of you. So thank you so much, and everybody have a great day. Thank you, Jessica.
Thank you, Adam. Thanks, Medical Monks. It is great. I appreciate the time from everybody. Thanks so much. Have a good day.
Thank you. Bye-bye.
Bye.